I'm Peter Block, and this is ACC.20 and the World Congress of Cardiology. This is a virtual congress at this point in time, and I'm honored to have with me Dr. Yangsu Jang from Seoul, Korea. Dr. Jang has just finished talking about the TICO trial, TICO, which is an interesting trial of ticagrelor with or without aspirin after 3 months in acute coronary syndrome. So, Dr. Jang, or Yangsu, if I may call you that, why don't you tell us what this trial is, why you did it?
In this trial, we wanted to make an ideal regimen, balancing the ischemia and bleeding in acute coronary syndrome after they got PCI. So one group we assigned the ticagrelor only after 3 months of aspirin and ticagrelor, and the other conventional group they take aspirin and ticagrelor for 12 months.
Okay. Now, on your slide of the primary outcomes, there's an interesting new sort of combined outcome, which is called NACE. What is NACE? NACE.
It's a net adverse clinical event at 12 months. That means the TIMI major bleeding, incidence of TIMI major bleeding plus major adverse cardiac and cerebrovascular events.
So this really includes the bleeding issue, which you're most concerned about, and I think that's a wonderful endpoint. So let's move on. There's 3,000 patients in this trial. So let's go quickly to the primary outcome. Your primary outcome, why don't you discuss that with the audience?
Yeah, in primary outcome, in the ticagrelor monotherapy group and the conventional group, during first 3 months, the primary outcome was exactly same. But after 3 months, in the ticagrelor monotherapy group, we stop aspirin. That makes a big difference. The NACE at 12 months in the ticagrelor monotherapy group is 3.9%. But in the conventional group, that means ticagrelor plus aspirin, shows that 5.9%. So big difference.
A really amazing difference. And this next slide shows that this is really driven by bleeding, isn't it, Yangsu?
Right.
So amazing that as soon as the aspirin is discontinued at 90 days, that suddenly the amount of bleeding is remarkably depressed or decreased in the monotherapy group. So let's move on to what I think is a fascinating part of this trial, and that is this whole business of which groups seem to do the best. You want to comment on that? Because I find it fascinating that women, hypertensive patients, older patients, and so forth, I'm going to let you talk about it, but it's amazing.
Yeah, in the older subgroups, the ticagrelor monotherapy group is favorable than the 12 months conventional group, the APT group. But in the multi-vessel group, disease patient, they shows a markedly statistically significant difference from the patient with multi-vessel disease. However, even in the patient with multi-vessel disease, is not inferior than the conventional group. So ticagrelor monotherapy is generally favorable all the subset.
It's an amazing outcome to me, but tell me why it is that women seem to do better.
We don't know exactly yet, but we need to investigate more.
So more to be learned about the women and more to be learned about muscle vessel disease for sure. So I should point out that this stent is the Orsiro stent, which is a particularly thin stent and is available in the United States. So I think it's important that we point out that this is something that is not just for Korea. So let's go to your last slide, the conclusions. I'm going to let you talk about them, but I think these are important conclusions that really will extend beyond simply your little trial.
So I think that ticagrelor monotherapy after 3 months DAPT is, I think is until now is the best regimen to balancing the ischemia and the bleeding. So ticagrelor monotherapy after 3 months of DAPT can be new regimen for ACS patient with PCI.
Okay, 2 questions for you before we quit. Number 1, have you switched all your patients now with acute coronary syndromes to ticagrelor plus aspirin for 3 months and then ticagrelor only?
Now we are doing another step, another trial we start, we call TPAS. We are shortening the DAPT duration within 1 month. So basically, my concept is the aspirin. When we have this kind of potent antiplatelet agent, ticagrelor or prasugrel, we may not need aspirin anymore.
Well, that would be fabulous. That would certainly diminish bleeding, possibly. We'll see how that comes out. So more to be learned. But lastly, what about the fact that this is a trial of acute coronary syndrome? Should it be extended to all patients that have either thin or even thicker stents?
I think so. Our study is in the line with the Twilight trial. I think Twilight trial is one of the best clinical trial in the patient in the ACS and the complex procedure. So they include the high risk bleeding patient only, but our patient group is more general acute coronary syndrome. So we can extend that to the all kind of the general ACS patient. And also, as you can see in the Twilight, they allow the second generation stent as well. So I think not only Oshiro, we can extend this to second or third generation stent, drug-eluting stent, I think.
Well, it sounds to me, Dr. Jang, like your trial has shown us that we will change how we take care of patients, certainly with acute coronary syndromes and possibly even broader patients. Thank you so much for being with me.
Thank you very much.